Hello everyone, and welcome back to Teacher English Speaking Channel, where learning English is easy and fun. I'm Lucy.
And I am Tom. Hello everyone. I am happy to be here today, but I have to be honest. I am not feeling very well.
Oh no, Tom, your voice sounds a little tired, and you look a bit pale. Are you okay?
Not really. I'm feeling under the weather today. I woke up feeling weak, and my whole body hurts.
I am sorry to hear that. Under the weather is a good idiom, but the feeling is not good at all. Tell me, what exactly is wrong?
I have a bad headache. It feels like my head is heavy. My throat is very sore, and I think I might have a fever. Sometimes I feel hot, and then suddenly I feel cold.
Oh dear, it sounds like you might have the flu. Have you seen a doctor yet?
No. And actually, I am afraid to go to the doctor.
Why are you afraid?
Because of English. What if I cannot explain my pain? What if the doctor asks something I don't understand? What if I take the wrong medicine?
Those are very common worries. Going to the doctor in another language can be scary, but your health is important. Tom, you need to see a doctor.
I know. Can you help me? If we practice what to say, maybe I will feel confident enough to go.
Of course. Today we will practice the entire doctor's visit from beginning to end. Everything. Making an appointment, talking to the nurse, speaking with the doctor, getting the diagnosis, and going to the pharmacy.
That sounds perfect. A step-by-step guide is exactly what I need.
Great. And to all our listeners, if you want more helpful English lessons like this, please hit the like button right now.
And don't forget to subscribe so you never miss our practical English lessons.
Okay, Tom, let's begin. Imagine you are at home, lying in bed with a box of tissues. You need to call the city medical clinic.
I am ready.
Good morning, City Medical Clinic. This is Sarah speaking. How can I help you today?
Hi. I would like to make an appointment to see a general practitioner today, if there are any slots available.
Let me check our schedule. Are you a registered patient with us? Or is this your first visit?
This is my first visit. I am a new patient.
Okay. Welcome. Could you briefly describe the reason for your visit so I can schedule the right amount of time?
Yes. I'm feeling quite sick. I have a severe headache, a sore throat, and body aches. I think I might have a fever as well.
I see. Dr. Evans has a cancellation and has an opening at 2 p.m. this afternoon. Would that time work for you?
Yes, 2 p.m. is perfect. I can make that.
Great. I just need a few details to set up your profile. What is your full legal name and your date of birth?
My name is Tom Smith, and I was born on January 1st, 1990.
Thank you, Mr. Smith. Also, do you have medical insurance?
Yes, I do.
Excellent! Please bring your photo ID and your insurance card with you when you arrive. We will see you at 2 p.m.
I will bring them. Thank you very much for your help. Goodbye.
Tom, that was excellent. You were clear, polite, And you provided all the necessary information.
Thank you. Breaking it down makes it much less scary.
Exactly. Now, let's fast forward. You arrive at the clinic at 2 p.m., fill out some paperwork at the reception desk, and sit in the waiting room.
Okay, I am waiting nervously. Then the nurse calls my name.
Correct. Before the doctor sees you, the nurse needs to check your vitals or vital signs. This gives the doctor a baseline of your health.
Okay, I am ready.
Tom Smith, the doctor is ready for you. Please come this way.
Hello.
Hi, Tom. Before we go to the exam room, please step on this scale so I can record your current weight and height.
Sure. I hope being sick hasn't made me lose too much weight.
Your weight looks stable. Please follow me to room 3. Have a seat on the exam table. I am going to check your blood pressure now. Please roll up your sleeve.
Okay. That is the cuff that squeezes my arm, right?
Yes, that's the one. Just relax your arm and try not to talk for a moment. Okay, great. Your blood pressure is a 120/80. That is perfectly healthy.
That is a relief. At least my heart is working fine.
Now, I need to check your oxygen levels and temperature. Please place this clip on your finger. Good. And now, open your mouth. I will put this thermometer under your tongue. Wait for the beep. Okay. Your temperature is 38.5 degrees Celsius. You definitely have a fever.
I felt like I was burning up.
The doctor will be in to examine you in just a moment. Please sit tight.
Thank you, nurse.
See? The nurse just needs basic cooperation. Words like scale, sleeve, and thermometer are key here.
I feel much more prepared. Now for the main event, the doctor.
Right? I will play the doctor now. Hello, Tom. I'm Dr. Lucy. I see from the nurse's notes that you have a fever and body aches. Can you tell me more about what is going on?
Well, doctor, I have a pounding headache. It hurts right behind my eyes. My throat is incredibly sore. It feels like sandpaper. And I have chills. I feel cold even when I'm wearing a sweater.
I see. Do you have a cough or a runny nose?
Yes, I have a dry cough. It's very irritating. No mucus, though.
Okay. And how long have these symptoms persisted?
Since yesterday morning, I woke up feeling tired, and it has gotten progressively worse over the last 24 hours.
I understand. I need to conduct a physical exam. Please open your mouth wide and say, "Ah." I need to check your tonsils.
Ah,
Okay, your throat is quite red and inflamed. Now, I'm going to listen to your breathing. Please take a deep breath in and out. Again. Deep breath in and out. Good. Your lungs sound clear. No wheezing or congestion.
that is good news. Doctor, be honest, is it serious?
One last question before I give my diagnosis. Do you have any known allergies to medication, like penicillin?
No, I don't have any allergies that I know of.
Great. Based on your symptoms, the sudden fever, dry cough, and body aches, It looks like you have the flu or influenza. It is not strep throat, which is good.
Oh no, the flu. That sounds miserable.
It is unpleasant, but for most healthy adults, it is not dangerous. However, you will feel weak for a few days.
Do I need antibiotics? I want to get better fast.
That is a common misconception. Antibiotics kill bacteria. The flu is caused by a virus, so antibiotics will not help. Taking them when you don't need them is actually bad for you.
Oh, I see. So, what is the treatment?
It is mostly about symptom management. First, rest is non-negotiable. You must stay in bed for at least 48 hours. No work, no exercise. Second, hydration. Drink plenty of water, herbal tea, or electrolyte drinks.
Rest and fluids. I can do that.
I will also write you a prescription for an antiviral medication to shorten the duration and something to help with the fever and headache.
Thank you, doctor. When should I expect to feel normal again?
You should start feeling better in 3 to 4 days. However, if your fever spikes above 39 degrees or you have trouble breathing, go to the emergency room immediately.
Understood. Thank you, Dr. Lucy.
You are welcome. Take care.
Wow. Playing the role made me realize the doctor just wants to help. It wasn't scary.
Exactly. Now, the final stop, the pharmacy. You hand the paper to the pharmacist.
Hello. I would like to fill this prescription. Please.
Sure. Give me 1 minute to prepare that. Okay. Here is your medication.
What are the instructions for taking this?
This is very important. Take 1 pill every 8 hours. It is best to take it with food to avoid an upset stomach.
Okay. 1 pill. Every 8 hours. With food. Anything else?
Yes, this medicine might make you feel a little drowsy, so please do not drive a car after taking it. Also, for your sore throat, I recommend these medicated lozenges.
Lozenges.
Yes, they are small, hard candies with medicine in them. You suck on them slowly to numb your throat.
That sounds soothing. I'll take a box.
That will be $20 total.
Here you go. Thank you for your help.
You're welcome. Get well soon.
We did it! I survived the whole process.
You did. Now, before we finish, let's quickly expand our medical vocabulary for injuries, just in case.
Good idea. What if I am playing soccer and I hurt my leg?
If you twist the joint, you say, I sprained my ankle. If the skin turns purple and blue from a hit, that is a bruise.
And what if I am cooking and the knife slips?
You say, I cut my finger. If blood is coming out, you say, it is bleeding. If the cut is deep, you might need stitches to close it.
Stitches sound painful. What about a broken bone?
You say, I think I fractured my arm or broke my arm. The doctor will order an X-ray to see the bone.
And for stomach issues?
If you feel like you are going to vomit, you say, I feel nauseous. If you actually get sick, you say, I threw up or I vomited.
Terrible feeling. Usually from food poisoning.
Lastly, mental health. If you are constantly worried, you say, I feel anxious. If you feel very sad for a long time, you might be depressed.
And if I can't sleep at night?
That is called insomnia. You can say, I have trouble sleeping.
This vocabulary is incredibly useful. Let's review the key terms from today: appointment, symptoms, diagnosis, prescription, pharmacy, side effects.
Perfect. And Tom, you had a golden tip for calling work?
Yes, if you are sick, keep your message to your boss simple. Don't describe your vomit. Just say, I am not feeling well today and cannot come to work. I plan to return tomorrow.
Professional and polite. Tom, I hope you feel better soon. Go home, drink tea with honey, and sleep.
I will. Thank you, Lucy. And thank you to everyone watching. If this video helped you, please like, share, and subscribe.
Question of the day. What is your favorite home remedy when you have a cold? Ginger tea, chicken soup, spicy food? Let us know in the comments.
We love reading your tips. Stay healthy, everyone. Goodbye.
Goodbye. See you next time.